My current position is a senior epidemiologist in the zoonotic diseases unit at the Minnesota Department of Health. We really work at the interface of One Health, where we're looking at the environment, humans, and animals and how they all interrelate to each other. Some of the impact that I've had, at least locally within the state, is this surveillance project through UMass, where we're the only people, to our knowledge, in the country that are actually looking at farmers and their families and trying to measure the burden of disease of enteric zoonotic pathogens, which is following people in real time that get sick and then asking them information about the types of animals that they work with, their job duties, the types of personal protective equipment that they may or may not be using. Now that we have sort of quantified that problem and saying this actually is a problem for farmers and their families, the next step is to figure out, are there interventions that we can put in place or things that we can teach people so that they can keep themselves and their families safer and healthier on the farm. I'm also really proud of working with 4-H and working with kids and trying to educate them when they're young about these different diseases and how to keep their animals and themselves healthy. So we've had the chance to do some really cool stuff like make a board game, make a toolkit that has built-in hands-on activities that club leaders can use, and figuring out how can we engage kids and make it fun for them to learn these concepts. So that's really rewarding for me. And then I'm also the rabies surveillance coordinator for our state. Our job is to keep human rabies rare in the U.S., and we do that by having the surveillance system where we test animals and where we have our phone line where people can call and get guidance from us on whether or not they need to be treated. My degree from the School of Public Health has really planted the seed of how important it is to have relationships and to have a network where you can call in people that can help you advance whatever issue or problem you're working on in public health. And I truly believe that having those deep and strong relationships is the way that you move things forward.